Often people think of the mouth as a sort of like a Lego piece, and it's a separate thing that we only have to deal with when a dental problem occurs. But it's great that it's being thought of more holistically, especially in a situation like menopause.
Welcome to Thriving in Menopause, brought to you by Prevention Magazine. I'm Zoe Mernier, the editor of Prevention. Thank you for joining me for episode 5 of season 10. Today on the podcast, we'll be exploring how menopause affects a part of the body that perhaps doesn't get as much discussion as many others, but can create some unpleasant symptoms which can lead to some pretty dire consequences if left untreated. And that body part is the insides of our mouths. Yes, there is even a term known as menopause mouth to reflect the many changes and symptoms that can affect our mouths throughout the menopause transition. To talk us through them and help us discover how to best treat them, we're happy to be joined today by dentist to the stars, Dr. Gamma Verdian. Dr. Gamma is the Chief Executive Officer at D Group, which encompasses both the luxurious Dental Lounge in Sydney's Double Bay, as well as Dental 99, which offers essential dental treatments for as little as $99. Dr. Gamma, thanks so much for joining us today.
Thanks for having me, Zoe. And I'm really grateful that, dentistry is getting a shout out here, especially when it comes to menopause. I think often people think of the mouth when they're thinking holistically as a sort of like a Lego piece that isn't really connected to the rest of the body. And it's a separate thing that we only have to deal with when a dental problem occurs. But it's great that it's being thought of more holistically, especially in a situation like menopause.
Absolutely. And as I'm sure we'll discover in the next little while, there is absolutely a huge link, and the repercussions can sort of go throughout the whole body. Am I right?
Absolutely.
Absolutely.
Over the last few years, we've found a lot of research is showing how our dental conditions affect the rest of our body quite significantly, particularly in areas of heart disease and diabetes and cognitive conditions like Alzheimer's and Parkinson's. So it's really interesting research happening out there right now.
Absolutely. So as I was saying, I think a lot of women don't often think about menopause in relation to their mouths. So talk us through just how some of the hormonal changes of menopause do affect our teeth and gums.
So with menopause, we see a drop in estrogen from even low levels to more significant levels. And that drop has a pronounced effect on our saliva. And saliva is so crucial to oral health because saliva is quite protective and it helps the good bacteria in our mouths fight the bad bacteria. And it has a washing away effect. So having much less saliva due to estrogen causes a sort of a negative balance where it's a lot harder for us to fight that bad bacteria. Low estrogen, also reduces blood flow, and it can affect the support structures around the teeth, like the gums and ligaments, and our bone density is affected as well.
Of course. We think of bone density in the rest of our body, but not so much in our mouths. So these changes can obviously manifest in quite a few different symptoms and conditions. So perhaps you can highlight some of these and walk us through some of the treatments available. So
Sure.
Let's start with dry mouth, which is one of the more common ones.
Yeah, dry mouth is very common, and that is absolutely a byproduct of loss of estrogen, and having a low saliva causes dry mouth. There's many different ways to treat this. One of the simplest one is to drink lots of water. Avoid caffeine and alcohol is also a really good way to do it. You want to avoid bitter foods. I know it's no fun, right? The other really great ways to do it is to have sugarless gum or sugarless candy, because that does produce a natural amount of saliva flow being increased.
Interesting.
You can also there's water spray bottles you can get to spray water in your mouth as frequently as possible. It's hard for us to understand, but it's quite debilitating having a dry mouth. I see my patients struggle with it a lot. And a lot of these patients will have really serious medical conditions like cancer. And one of their biggest day-to-day complaints is just having a dry mouth.
Yeah. It's one of those conditions that's just it's kind of so annoying and just it's always there, right? And I was going to say excessive thirst is also part of this too, isn't it? So you've not just got a dry mouth, but you're feeling very thirsty all the time.
There's a few other sneaky ways to help with this. It's having like frozen watermelon and papaya as well helps stimulate our saliva. You can also get acupuncture to help stimulate your saliva. I can't explain that. I'm not a Chinese medicine expert, but that is a common prescription we give our patients.
Wow, good to know. And yes, nothing like a frozen watermelon ball in summer, that's for sure. So sensitivity, I guess, is another symptom that crops up quite commonly.
Yeah, sensitivity happens to all of us when we have less enamel protecting our teeth, right? So the underlying tooth structure, it's called dentine. So once we have exposed dentine, you get quite a lot of sensitivity. And this happens a bit more during perimenopause and menopause from the saliva effects and also from the effect we have on hard tissues. So the solutions for sensitivity are one of the best things and one of the I'm really proud of dental research is that we have excellent sensitive toothpaste these days. And they actually work and work well. Some of the newer ones from Sensodyne and Colgate it's called Pro-Sensitive Relief. They really work well for sensitive teeth. So that's probably the number one thing to do. The second one is if the sensitivity is bad enough to come and see a dentist, we have all sorts of, professional grade desensitizers.
Okay.
And in some cases, we can put a protective coat over the affected areas, and that sort of creates a barrier between the external environment and that underlying nerve that's inside the tooth. And in some cases, we'll have to put fillings to protect the exposed dentine if there is enough wear there, and there is a real reduction in enamel. That would be another pretty simple-ish solution.
Oh, it's good to know that there are so many options out there. Okay, so another big one, gum inflammation and or receding gums.
Yes. So this is probably the one that most patients notice when they have menopause, the changes in their gums. Also happens during pregnancy. So you get quite a lot of surprising inflammation and swelling and redness of your gums, which manifests when you're brushing your teeth, that you start to notice blood during brushing. And that shouldn't happen. And there's a twofold effect that happens to all of us is once we brush a certain area and it's quite sensitive, we stop brushing that area. And that makes it worse because the plaque accumulates and then you can get some really nasty infections that way. So the first remedy for this is to have excellent oral hygiene. So whatever you're doing, triple your efforts. So if you're brushing for a minute a day and not brushing in the evening. So you want to be spending 2 to 3 minutes brushing and really getting into the area that's bleeding. So if you notice an area that's bleeding when you're brushing, just keep brushing it and spend more time in that area. And it will cause it to bleed, which can be alarming at the start, but that's the quickest way to get healing.
Right.
The other really important thing to do is to have very regular checkups and cleans. The body is so sensitive to bacteria and plaque during menopause that the removal of it is really crucial. So we strongly recommend having a maximum of 6 monthly cleans, and we really encourage 3 monthly cleans during menopause when we're having gum-related issues. And 3 months will come around very quickly.
Oh, yes.
So our patients on 3 monthly cleans, they feel like they're having a clean every week. So the last thing you can do for gums is a mouthwash, but you want an alcohol-free mouthwash and one that's targeted at bacteria around the gums and not teeth. So something like Colgate has a few good options and Savicol has some options. That's the other way we could get a little bit of help in that area.
Yes, because obviously an alcohol-based one would exacerbate all those other conditions as well, like dry mouth, and yes, not a good thing,
Absolutely.
Right? Yeah.
And surprisingly, we've found over a long period of time, alcohol-based mouthwashes do increase your risk for oral cancers. So we want to
Yikes.
These days we avoid them at all costs.
Absolutely. So, I mean, as you were saying, with gum inflammation, you can get some infections. So, pretty much gum inflammation and disorder is the one that is really the more dangerous, isn't that right?
Absolutely.
Yeah.
I think it's noticed in about 45% of patients who have menopause. So the frequency of it is quite high.
Absolutely. Now, here's an interesting one, burning mouth syndrome. Tell us about that, because I've heard that it's really, really quite nasty.
Yes. So burning mouth, it's basically a really uncomfortable condition where you have a sensation in your mouth, commonly around the tongue area, that it feels like burning, and you have tenderness and numbing and a numbing feeling and pain. It's really alarming to a lot of patients. And the solutions are good, but a lot of it does have to do with the saliva. So the reduction in saliva creates a higher incidence of burning mouth. So hopefully none of us experience this. I haven't had it yet, but it is something absolutely to avoid. So some of the solutions to it is everything we said for the saliva replacement. So you want to make sure you have good saliva flow.
Yep.
You can get oral mouth rinses that have a numbing gel component to it when it happens. So you sort of end up numbing the mouth.
Okay.
Other solutions to this, alpha lipoic acid.
Yep.
Or ALA. It's an antioxidant that helps with nerves. And the second one is capsaicin. And these are supplements basically, and capsaicin comes from chili peppers. And I know it doesn't make sense to use it for burning mouth, but it does help with nerve-related conditions.
Right.
There are also stronger medications that block nerve pain. We want to avoid those as much as we can. And then there are a few like home remedies that are non-medical ones. Some of the simpler ones are, avoiding alcohol and smoking.
Yep.
If you have burning mouth, you really don't want to have acidic foods. So we're talking about, tomatoes, orange juice, apple juice, any carbonated beverages like Coca-Cola or Coke Zero. And you know what? Coffee as well doesn't help. And you want to avoid spicy hot foods. And sometimes when you have, those really strong toothpaste that have a strong minty flavor,
yes,
that can exacerbate the condition as well.
Okay. And so is burning mouth syndrome, how common is that?
Look, it's not as common as low saliva, but we do see a reasonable amount of it. A third of people with menopause will experience dry mouth.
Right.
A third of patients will experience all the gum-related issues. The numbers are much less for burning mouth.
Okay, good. Okay, that's something. All right. Now, oral thrush is another one that I presume is also brought about by the low saliva.
Yes. So the fluctuating hormone levels create again a imbalance in the oral microbacteria.
Yeah.
And it creates an environment where fungus can thrive, and we end up with these white raised patches in the mouth, which some patients freak out when they see it because they think it's cancer.
Yeah.
But often it's fungus caused from Candida albicans. Now the solution is fairly simple here. Warm saltwater rinses, followed by an oral antifungal solution, and that's usually Nilstat. Is the oral mouth rinse we give to patients.
Okay.
And use that. And then you can also get antifungal tablets, but usually we start with warm salt water rinses and Nilstat, and then we usually
escalate from there if need be. Yes.
Exactly.
Yeah. We'll be right back after this.
Perimenopause can actually start in your 40s. Declining estrogen production during perimenopause brings on changes to menstrual cycles and often the onset of hot flushes, night sweats, mood swings, and sexual problems. Promensal Peri is specifically designed for perimenopausal women and can help relieve these common menopausal symptoms. Promensal Peri is available at leading pharmacies across Australia and offers a cost-effective treatment at under $1 a day. When things start to change, try Promensal Peri. Always read the label and follow the directions for use.
Okay, we're back. So I guess another one that is probably interwoven with all of these is experiencing bad breath, which of course for some women can be the most horrible one of all because it is, yes, it's socially unacceptable.
Yes, and it's noticed by everyone.
Yes, indeed. So again, I guess there's a similar solution as to the other ones as well with the non-alcohol mouthwash and trying to increase the saliva in the mouth. Is that right?
That's absolutely right. The other thing that causes bad breath is the gum-related issues. So really a good clean by a dental professional would be crucial at that point. The other thing that happens quite frequently is we have other dental conditions like cavities in our teeth or holes, or as the gum conditions progress, you might have what we call periodontal disease, which is gum disease, which is quite a serious condition where bacteria, not only are they inflaming your gums, but if you leave those bacteria, they start to eat away at the ligaments and bone that support teeth.
Right.
So whilst they're doing that, they release some sulfur-based chemicals, which create some really bad breath.
Ah, yes. And again, treatment the same though for that?
Yes. Treatment is exactly the same. So if you do have gum disease, though, we start with a general cleaning, but we generally progress to what we call a deep gum cleaning, which is essentially where your mouth is numbed and cleaning and scraping happens all under the gum, where all that bacteria is residing and wreaking havoc.
Right. Okay. Yes, definitely good to have the anaesthetic for that one. Now, I know you mentioned with periodontal disease that it destroys those ligaments. So I know that loose teeth can be another problem. And is that sort of directly related to periodontal disease, or can that happen on its own as well?
No. It's absolutely linked to periodontal disease. So we do not get loose teeth otherwise. Sometimes you can have loose teeth from whether you've had recent orthodontic treatment or post having braces. Our teeth feel a little bit loose, but in the general adult, loose teeth are a cause of loss of attachment, which is most likely happening due to advancing gum disease.
And when we get to that point, what can be done to reverse that?
Okay, so there's different grades of gum disease: mild, moderate, and severe. So mild and moderate gum disease can be reversed to a certain extent.
Yeah,
we can't magically regrow bone that's been eaten away, but we can increase the attachment around those teeth. So where the ligaments strengthen up and the gums become healthy and they strengthen up, and that either stops the progression of the tooth mobility or improves it. But if you have really loose teeth, most likely they will be coming out.
Yeah. Okay, so key here is to visit your dentist at the moment. The moment you're kind of aware of any of these gum issues, and
absolutely. As soon as you notice a little bit of bleeding or a little bit of swelling, it's really important to see a dentist and get a checkup and a really good clean, and stay on that, stay on the routine.
That's it. If you're going to see your dentist,
especially during menopause.
Yeah, if you're going to see your dentist every 3 or 6 months, then they're probably picking it up anyway and addressing those issues as they come up. So what about, I know, obviously menopause is a time where women are experiencing a lot of anxiety and stress. So what about if women are experiencing, say, jaw clenching issues, or, sort of tension around the jaw and perhaps even sort of headaches caused by sort of having that tight jaw area, which is where we obviously store a lot of tension.
Yes, that's a very good question, Zoe. And since COVID, we have seen a huge increase in the incidence of jaw-related issues. So I think some of it came from the stress and anxiety during that time. And we saw a lot of, cracked teeth, broken teeth, and then subsequently issues related to excessive clenching and grinding, and we call that parafunction, and then which leads to TMD, which is temporomandibular joint disorder.
Yep.
The solutions can be pretty simple-ish early on. First of all, we got to correct if there's any jaw tooth-related issues. So if we've got cracked teeth that are affecting nerves, or if we have cracked teeth that are quite sensitive, we need to look after them. And whether we do fillings or potentially we cover the whole tooth in something like an orthodontic band or a crown. And sometimes you can cause so much damage, you need a root canal therapy or you lose that tooth, right?
Yeah.
But let's assume none of that is in place and we're just noticing our jaw is in play. There's two treatments that are really beneficial for this. The first one is what we call a night guard or an occlusal splint, which is very similar to a very specific design for a mouth guard. And it is a lot thinner than a sports mouth guard. And you wear that at night when you are asleep and you have no control over the clenching and grinding you're doing.
Yeah.
And that allows your jaw to rest during the evening. And it also, a really well-designed splint will put your jaw in a much more comfortable position. So it's, I say it's akin to sort of, if you have a knee issue, you wear a knee brace when you're running.
Yeah.
It's the same thing that you do when you're asleep. You wear an occlusal splint so that whilst you're at your worst, you have something protecting you. The second thing we've been doing for the last sort of 5 to 10 years, and often this is an adjunctive therapy, and we do it both at the same time, or sometimes we do it exclusively, is we put Botox into the masseter muscle. With enough Botox, you can reduce the strength of contraction. It doesn't really affect your appearance, especially initially, but what it does is it reduces your ability to clench and grind really hard.
Yeah.
And this does not have an effect on your eating habits at all. It's just that top end power and strength is reduced, which again gives your jaw an opportunity to relax. The beauty about Botox is once it kicks in after days 3 to 7, it works all the time.
Yeah.
Whereas a night guard is only useful during the evening, and it's not a good look to go to work or anywhere outside your house with a night guard in place.
No, indeed. Although I guess with the Botox, you do have to keep getting it done every 4 to 6 months, right? Yeah.
That's correct, yeah. And some, for people who do clench and grind a lot, it only lasts like 2 or 3 months.
Right. Still.
Yeah.
It's often often a good sort of circuit breaker though, isn't it? Just to kind of, if you are in that acute pain phase.
Definitely.
Yeah. I've had some.
We see patients now have a lot of relief with Botox. And, the night guard therapy does take a little bit more time to kick in. Most of my patients end up choosing both options.
Okay, so in summing up, what are the best ways that women can support their teeth and gums during menopause?
Okay, I'm going to say all the boring stuff first, right? So avoid spicy foods and acidic foods. Avoid, if you can, as much alcohol and coffee as possible.
Yeah.
It basically comes down to having a healthier lifestyle during this phase of life. So, lots of water, lots of healthy habits like, chewing sugar-free gum, keeping ourselves fit and healthy. A lot of these conditions are affected by mental health.
Right.
So, saliva production can be affected by all sorts of mental health conditions and the medication that is required to treat them. So looking after mind, body, spirit.
Yeah.
So, mindfulness exercises, doing some yoga and Pilates and keeping fit, active and healthy. All of these plays a really big part in oral health. And we often do see, and there's a lot of research to back this up, that a healthy oral health is very much in line with a healthy human being. So putting that all together, I would also just add, in terms of oral health stuff, really crank up your habits. This is like not the time to get lax in how you look after yourself.
Yeah.
And it's fairly simple. we must brush our teeth twice a day for 2 minutes. I use an electric toothbrush with a timer, because if you leave it up to me, I will finish at about 36 seconds if that timer is not there.
Yeah.
So doing that, it's really important to floss. When you have sensitive gums, the name of the game is to get as much of that bad bacteria and plaque away from your teeth and out of your mouth.
Yep.
And then lastly, it's really, really critical to have regular checks and cleans, because a small gum infection can be treated quite easily, but a really large gum infection can have all sorts of systemic effects down the line, but more complex treatment, which you want to avoid as much as possible.
Absolutely. Well, that's great. Dr. Gamma, thank you so much for joining us today. It's been great having you on our podcast.
Thank you, Zoe. I appreciate you having me, and thank you for including dentistry in your podcast.
Absolutely. And listeners, thank you for joining us as well. If you liked this episode, we'd love you to rate, review and subscribe. And we hope you'll join us for next week's episode. Meanwhile, for more information about living your best life at midlife, pick up a copy of Prevention Magazine. I'm Zoe Mernier. See you next time.